I can. Does that work? How's that, Juana?
That's better.
That's better. Okay. Um, Hi guys, my name is Belen. I am clinical director for First Day, and today we're going to be talking about HIPAA. And don't get scared because we have a lot of slides. Okay, we're also going to move just as fast as our other presenters. So welcome. Thank you for being here. We will be talking about HIPAA, which is the Health Insurance Portability and Accountability Act. It's a law that was passed in 1996 to protect patients' privacy and ensure that health information is handled securely. It also gives clients more control over their own medical records. So let's break that down and how that looks for us in a practical way. Oh, we skipped right through our mission statement. Who wants to help me read our mission statement?
I can read it.
Thank you, Rudy.
Whittier Area First Day was founded on a vision for a healthy, safe, and vibrant community, which encompasses everything from securing housing, stable health, and productive employment to resident engagement, civic involvement, and respect for one's neighbors. First Day's mission is to help homeless and at-risk individuals and families transition towards self-sufficiency.
Thank you, Rudy. Okay. So why does HIPAA matter? Imagine that we lived in a world where anybody would just have access to your medical records, um, without asking any of your permission. Scary, right? HIPAA sets the rules to prevent that from happening, and it ensures that our private health information stays private, while it still allows necessary access for treatment and for billing. There are three main components to HIPAA. And those three components are one, privacy rule. This one sets the minimum standards for keeping patients' information confidential. The second one is a transaction rule, which focuses on the safe electronic exchange of health data. And the third one is a security rule, which protects health information through both physical security, like locked file cabinets, and digital security, like encrypted emails. Okay, that was us. That's what I just said. So, what information is covered? When we talk about protected health information or PHI, we mean any data that can be linked back to a specific patient. This includes things like medical history, treatment details, billing records, and even basics like names and addresses. If the information can be traced back to an individual, it falls under HIPAA. PHI use versus disclosure. So let's clarify something important. Using PHI versus disclosing PHI, and we're allowed to do both, right? When we use it, it means that we're handling patient information within our own organization, and we're doing this so that we're able to provide a better care, better quality of care among all kinds of disciplines. That's different than disclosing, which we're also allowed to do if our clients allow us to. And this is when we're sharing it outside of our organization, like sending medical records to another provider. Both of these we're allowed to do, and both of these allow safeguards for our patients and their security to patient rights.
Berlin, can I ask a question really quick?
Yeah.
Two questions actually. So, when do we have the right to share this information? Do we need some type of consent form, um, or maybe something from the client that give us permission to communicate to the other party?
Yes, absolutely. So we do need consent from our clients to be able to share this type of information. However, while I was doing the intakes, there are some agencies that we're already allowed to collaborate with, and that's part of our intake process.
Just wanted to make sure that we covered that. Thank
Okay. Okay, so our clients do have rights under HIPAA. One of the most important aspects of HIPAA is clients' rights. They have the right to first see a notice of private practice, which explains how their information will be used. They also have the right to request restrictions on who sees their PHI, which goes back to what Randall was saying, like who's allowed to see my information and who cannot. They have access to their own records and can even request corrections if they believe that something is wrong. They have the right to receive a list of who has access to their PHI within the last 6 years. So HIPAA isn't just about rules, it's also about empowering our clients. And as we are having them sign all this information, we should be explaining these rights to them as well. Breaches and what happens next. So let's talk about what happens when something goes wrong. A breach is any unauthorized use of disclosure of PHI. If a breach happens, sometimes they do, your organization does have responsibilities to the client and to the public. So we must notify the individual who's affected. We must notify the Department of Health and Human Services if more than 500 people were affected by the breach. And there's even a responsibility to notify the media if it's a large-scale breach. So it's a big deal, right? We want to protect our clients' information because transparency is important. What's not considered a breach? So not every accidental slip-up contains a breach. Here are some exceptions. If an employee accidentally accesses the wrong patient file but doesn't share it, then that's not a breach. If PHI is sent to the wrong department, but both parties are authorized to see it, that's not a breach. If the recipient of a mistaken disclosure is unlikely to retain the information, like when a fax is sent to the wrong number, but gets returned immediately, that is also not considered a breach. We do have security standards, physical security to protect PHI. Some of the things that we do as an organization and we should be ensuring that is taking place is keeping our office doors locked. If we're storing medical records, making sure that files and paperwork aren't left out for unauthorized people to see. So even just like flipping a paper over, being mindful of who's in restricted areas, right? If we see unfamiliar faces, we can kindly ask if they need any help. They should not have access to be able to see any of our clients' information. You know, even our conversations should be HIPAA compliant. We don't talk about patients' cases in the hallways. We don't talk about them in waiting rooms or elevators because we never know who's listening. We have to be mindful of who's around when discussing sensitive information. And if you have to talk in a public area, please keep your voice down. Do it in a way in which we're still being protective of the people that we are serving. Security standards and documentation. So we can be honest, paper records can be a security nightmare, right? We have papers, sometimes we have shared spaces and there's papers all over the place. But we don't want to leave printed documents unattended at the printer or the fax machine. If you have to keep documents in a shared space, make sure that patients' names are covered and shred any sensitive paperwork instead of just tossing in the trash. We're actually not allowed to do that. Make sure that you're shredding any paperwork that has sensitive information of our clients. I think my PowerPoint is all out of shape, like all out of order, but that's okay. You guys have it anyway, so you can go back to it. We also have security standards on personal devices, right? Most of us, a lot of us use our personal phones. We do have devices in which we're communicating for work purposes. So always password protect your device. Don't store any PHI on personal phones or unencrypted USB drives. If a device with PHI gets lost or stolen, report it immediately, okay? Do not be scared to tell on yourself. We want you to tell on yourself. We want to be able to help you and we want to be able to fix the issue promptly. Confidentiality and professional ethics. At the heart of HIPAA is confidentiality. It's both a legal and ethical responsibility that we have for our clients. We must protect what clients share with us. Only discuss patient information when absolutely necessary. If we break confidentiality without a valid reason, it's considered unprofessional, it's considered unethical. And there are legal consequences for it as an agency and as individuals, as professionals. So I know that I just like flooded you with information, but at the heart of HIPAA, uh, it's yes, we want to be compliant, but it's not just about compliance. It's also about our clients trusting us with their information. It's about them knowing that we have created a safe, protective environment for them where they can open up and tell us what's going on with them and allow us to help them. And so by following these guidelines, we're not just avoiding legal trouble, but we're also creating ethical and professional spaces where people feel cared for, and we can build long-lasting relationships with our community. That's it. Randall, anything you'd want to add to that?
I do not, but I will like to share some news with the group that you did it. So as you guys probably don't know, you can stop sharing, Juana, by the way. Belen,